I'm curious, you had the research team that you have where you're working with a group of individuals that are researchers with Down syndrome. How is that accepted amongst the medical community or other professionals?
Yeah, it's really interesting. I did not come up with this idea, right? There's great folks that have pioneered this work, Ariel Schwartz and Jessica Kramer and Carla Asterow, that's in New Hampshire and Florida and Wisconsin. But sort of when I bring it to kind of the public health medical campus folks, it's like I've invented fire, right? Like, it's this is so innovative. Who would have thought that we could like talk to people and like my sense is that it's very foreign at the moment, but in terms of like where our culture is moving, it's going to be the norm. That this like kind of the disability rights movement has this like nothing about us without us mantra that right, we need to be involved in anything that affects our lives. And I think as more groups get organized and together, whether it's multiple sclerosis or depression or Down syndrome, that there's going to be more of this demand that if you're researching about me, I need to get my input in there because I know more than you do who just studied from a textbook. So I think that sort of the field is the just research in general is going to move a little more in that direction, at least in this sort of social research. I don't think we're going to have, you know, people with Down syndrome dissecting the mice unless they really like to do that and want to do that as a career. But, sort of that is a specific trained skill of research that anyone can do, but it's not, having Down syndrome doesn't inherently add expertise to that task. But sort of these ideas of what is your life like, what's important to measure. I think that we're on the forefront of sort of that being the norm where it's almost unethical to do research without consulting with representatives of the community.